take a quick question here for you to answer. I want to know much about adult onset asthma. Is that a thing?
Oh, yes.
Adult onset asthma, LABA and SABA, and how this helps in the management of remodeling the airways. I also want to know about the side effects of the LABA. I was diagnosed of asthma last week. This is a viewer here. So let's begin with what's adult onset asthma.
So adult onset asthma, simply put, is you being diagnosed with asthma in your adulthood.
Okay.
So
you're older now.
You are older now, and then you got to know that you have asthma. So as I said, probably the person got exposed to a triggering factor that led to the development of the signs and symptoms, and then went to the hospital and they got to know that. And aside other investigations that were done, they got to know that, oh, this person has asthma.
What's LABA, SABA? Is that
so LABA is long-acting beta agonist, and SABA is short-acting beta agonist. So these two medications are used in the treatment of asthma. They help, as I said, asthma leads to the narrowing of the airways and also swelling of the airways mucus. So they help relax the muscles and open up the airways. That is what these two medications. So short-acting means it's given immediately to relieve the patient of the symptoms, and then the long-acting is a long-term medication that the patient is placed on.
So they're basically the same medication. One is just long-term, and one is short-term.
Not necessarily long-term, short-term. Short, like you are given. It's given to the person to act immediately.
Okay, to act immediately, and the other is meant to act for a long time.
It takes time to long.
That's interesting. I also wants to know about the side effects of the LABA. That's the long-term one.
Okay, so the side effects of the long-term one, it's there are a few side effects. Normally, the patients might have symptoms like headache, nausea, vomiting. But in cases where you have any of these side effects, you should consult your doctor so that change of medications are done.
But basically, you're assuring him that these are legitimate drugs, the SAB and LABA.
Yes, so these are drugs that are prescribed.
He seems to be very concerned because she was diagnosed just last week. He's an adult. I'm sure it's new to him, so he's also trying to find his feet.
Probably there's a family history hiding somewhere.
Possibly. Let me take one more message. Hello, good morning. My name is Dorcas. I would like to know if the constant feeling of a tight chest and sharp pain in the chest are signs of asthma. I sometimes feel like I do not have enough air to breathe, and I gasp for air, especially when I sneeze. I have been diagnosed of anxiety before. I don't know if there's more to it. I also have allergies and tend to have outbreaks. I'd really appreciate your input, doctor. So this person has quite a number of issues going on. This person has a tight chest. She struggles to breathe sometimes, especially after she sneezes. And also she's been diagnosed of anxiety before. So she wants your input on this. Okay,
so with the symptoms she's mentioning, they are related to, they sound similar to that of asthma, but these symptoms also can be found in conditions like myocardial infarction, that's more like heart attack, and also anxiety. When someone is anxious, some patients present with such symptoms. I'm sure that's why she was diagnosed with anxiety. But it would be appropriate for her to see a physician so that the right investigations would be done, so that she would know particularly if it is asthma or not.
Well, that's very, very interesting messages I have there. I'll take a few more, but let's come back to our main line of learning about asthma before we jump back to the questions. Where do these inhalers come in? Let's talk about the management now. It's not totally curable. There are a lot of messages that are asking if this is curable. You've already said it's not. So how can you do a proper management of asthma?
So for a proper management of asthma, first and foremost, I would say you should identify your trigger factor. Once you get to know what triggers what triggers that you having an acute asthmatic attack, you'll be able to avoid those trigger factors. That is one. And then two, you should go to the hospital to see a physician so that appropriate measures are put in place. So the
first thing is to identify your triggering factor. If it's a strong perfume or it's your work environment, or is the air you breathe wherever you went to, that might be dusty or whatever. If you are able to know that, that informs you.
That informs you that you have